Okay, so this gentleman right here had already a brow lift, and he had a brow lift by making a small incision here at the eyebrows, and the stitch was placed to just lift a little bit. Unfortunately, if you look at his pictures, his brows are very, very low, and he also has a major crease right here in the middle. You can't appreciate that at this point in time just because we've already infiltrated with the local medication. So there's a few ways. Can I have a forceps? There's a few ways of actually doing the brow lift. One can make an incision on top of the brows here and remove a little bit of skin to lift that up, and that works really well. And usually that's done in males, not females, and it's males that have pretty much bushy brows so they can hide the scar appropriately. The other method, which I do like to do, but in his case I figured that it wouldn't lift the brows as much, is to make a small incision here, one here, same thing on the other side, and put something called an endotine, which is kind of like a carpet tack, which we lift the brows up, put pressure on the skin and on the tissue, and it holds it very well. That little endotine, just like dissolvable sutures, will dissolve within a period of 10 to 12 months. And then the other ways of doing it is to make an incision, which is called a coronal, or a pretrigial, which is what I have right here, which is in front of the hairline. If I make a coronal here, incision, then it's going to lengthen his forehead, and he already has a little bit of receding hair here, so we want to try not to do that. So I chose to do a pretrigial brow lift, really to give him a much better lift than he would otherwise get from the limited brow lifts that I just mentioned right now. So we'll get started by making an incision following the blue line down to here. We'll bring the skin and tissue down, release the fascia down here, release the muscle, release some of the muscle here that causes the scowling that sometimes is seen where people get Botox, and then advance the skin and try to remove a little bit of the skin, which will allow us to really lift the brows up.